When patients come to me and they tell me when is the best time to start exercising so that I have a natural birth, I tell them 2 years before pregnancy.
Exactly, yeah.
Right?
Yeah.
She is a healthcare worker or she is a primary school teacher.
Okay.
She's more likely to acquire viral infection from the kids around her or patients around her. So she may require a different battery of tests.
Okay.
Compared to, say, a software engineer who is working from home.
Okay.
If she has a pet, she needs different kind of environment and testing than somebody who does not have pets.
Yeah.
So the habits of the parents, they do impact the offsprings.
Okay.
And when I say habits, it's not only about addictions. It's also about lifestyles. So say, for example, sugars. A simple diabetes which impacts the third trimester of the pregnancy, called as gestational diabetes, can cause premature births, can cause big babies, traumatic deliveries, cesareans, post-delivery complications in the baby, and early diabetes in the offspring.
Okay.
If the same person were to control her sugars well, and in 90% of the cases, she can do it by diet alone with exercise. She does not need medicines.
Yeah.
Then that person, I jokingly tell, it's easier to be prime minister of our country compared to for a sperm to become a father.
Oh,
Because
God, yeah, actually,
millions and millions of them every ejaculate.
Yeah.
Lifetimes of ejaculate.
Today I have a gynecologist with me who genuinely cares for people and their emotions. I have seen him with each and every patient, and he has the same enthusiasm, same energy when he's greeting each and every patient of his. And he has this energy, which cannot be matched. Like, I have not seen other doctors where he makes the patient feel so comfortable that he understands them and their problems. Apart from that, he is also someone who has this hands-on thing on getting to know all the latest technologies in fetal medicine, in terms of overall women health. So he has his own clinic, he has his own hospital, which is Umarji Mother and Child Care Hospital, which is in Baner. And today we have with him here. But before we dive into this conversation, I would like to welcome Dr. Chinmay. Welcome to Sukoon's podcast.
Thank you, Payal.
And before we start into grilling into the deep conversation, I want to know, where do you get this? What is the secret sauce of energy that you have at least 100 plus patients every day and you're greeting all of them with that same kind of energy?
I think it's the branch. Because unlike many other branches of medicine, here I and my patient are happy together.
Yeah.
Right? So it's, I think, that positivity and inherently medicine itself is immediately rewarding.
Yeah.
You touch a patient, you make a diagnosis, you feel good. You treat her, she feels better, you feel much better. And these rewards, I think, come only with medicine and very few other disciplines.
Yeah.
So I'm really blessed to be here. And every time I see patients, they are most of the times happy. And that's the reason why, although I'm a fetal medicine specialist, I still love birthing. Because birthing is giving you all that positivity, all that natural chemistry between you and your patient. That kind of comes out so well when you're throughout with her. You get to spend those 9 months and then you get to spend the time in the labor room. That very rarely happens with other branches.
Yeah. So that is why gynecology, like, there are like so many other sectors, of medicines that you could go to. But why did you choose this?
I think that is the reason why. So I come from a family of doctors, and so my father is a physician. He was teacher all his life, and my mother is a gynecologist, as you know. So I got to see both those disciplines up close, and then there were so many friends and family who are in other disciplines. And I think that is how I got inspired into doing obstetrics. So even in obstetrics and gynecology, there are so many other disciplines, which I tend to practice because it comes with the profession. But I really focus upon is high risk pregnancy, low risk pregnancy, natural birthing, water birthing, and fetal medicine. Fetal medicine initially was a passion.
Okay.
And also it was a necessity of Pune at that time. We didn't have as many fetal medicine specialists. Even today, we don't have as many fetal therapy centers.
Okay.
That is the reason why I got into it and was blessed to get trained with best of the people. But passion was always birthing.
So, like, if you could tell me what is the difference between fetal medicine, like for you like people who are listening to us, what is the difference between fetal medicine and like maternal? Is it like two completely different sectors?
Absolutely. So, expertise-wise, they demand different sort of expertise.
Okay.
But pathology-wise or even physiology-wise, they are quite inherently linked together. So, let me explain how. A girl who has high blood pressure
Okay.
conceives. So, this is maternal medicine.
Okay.
So, as an obstetrician, I need to work with multidisciplinary teams who will tell me how to safely control her health
Okay.
and then optimize pregnancy outcomes. At the same time, that high blood pressure of hers and the medicines and the reason why she has high blood pressure, all of that will have impact on my baby.
Right.
So, I need to anticipate that impact,
Okay.
make those aspects pregnancy safe and baby safe,
Okay.
and try and pull on pregnancy as much as possible. So, with a
Okay.
previous pre-existing high BP,
Yeah.
I know that I may have a small baby, undergrowth of a baby.
Yeah.
I may need to deliver them early.
Okay.
I may have a mother who suddenly shoots up her baby, say in her 8th or 9th month. And then anticipating all of this, one has to control those conditions.
Okay.
So that is maternal medicine when you are dealing with mother's high blood pressure.
Okay.
Fetal medicine when you are dealing with its impact on the baby.
Okay. So, could you say, like, was this one of the reasons why we used to have, like, a lot of babies dying 30 or 40 years ago, where even sometimes the mother was not keeping well, and then during the labor, she was, like, going through a lot of pain, and you couldn't really know and understand what's going on. And sadly, either the baby or the mother was at risk.
That's a very good question, and I agree that if you look at the history of birthing, this is probably the safest of the times to deliver.
Okay.
And probably we will be looking at a better future henceforth. When, say, many of us were born in the 90s, the whopping 434 mothers out of 100,000 we would lose to pregnancy and birthing.
Yeah.
That number drastically started declining once we started implementing modern antenatal care, as we call it. And now that number has reached in its 70s nationwide, in 30s in Maharashtra and Pune.
Oh, okay.
So we're doing much better.
Yeah.
And that's because now we have started understanding the pathology. Similar strides we are trying to achieve with baby's care as well, but still we are miles away from it.
Yeah, yeah. And so is this something that you were passionate about, or while you started getting into maternal health care, or is this something that you realized later, that this is something that is lacking in the Indian medical system and we need to, upgrade and reach there?
So I believe India for thousands of years has given best of the doctors.
Okay.
If you read the ancient scriptures, there are incidences of Indian doctors, Ayurvedic doctors, going to Misr, which is now Egypt, and doing a cataract surgery there.
Okay.
You have, even in 1800s, Indian doctors going to Kingdom of UK and doing a cataract surgery there.
Okay.
So I think we are quite blessed with talent when it comes to medicine here. And I got to work abroad as well. And most of the healthcare, even there, is being overrepresented by Indian population.
Yeah.
And that's probably because it runs in our blood. What we need to bridge the gap with is probably the organized care.
Okay.
Because we need some central guidelines, we need some auditing.
Yeah.
I think that is what got me intrigued.
Okay.
And I wanted to learn how that care delivery system. So, see, inherently, a doctor would want their patients to be better.
Yeah.
And it is selfish as well, because that is how I'll get my next patient, right?
Yeah.
So it's always a mutual win-win when my patient gets better, and every doctor across the globe, I'm sure, strives really hard for that.
Yeah.
What we need is systemic support. We need organized framework, we need softwares, we need machines, we need technology. And we need maybe imparting of counseling skills, soft skills, other aspects, which are largely lacking in our public health system.
Yeah.
And that is what got me intrigued, I guess.
So what is it that we could do so, that everything is like systematically organized and everyone is helping each other out to actually get us to a better place?
So actually, we have already started doing a lot.
Okay.
There are guidelines which are coming up, and the governments are trying to be more robust about it.
Okay.
More auditing is being done, especially when it comes to the public health care of India. I'm seeing in last decade or so, the quality of equipment in public health care is improving. The money being pumped in is much more than what it used to be, say, a decade ago. And they are also quality conscious.
Okay.
So now they expect international standards to be implemented in their equipments across the country. And ideally, those standard equipments to be manufactured in India, which unleashes a huge ecosystem, which will eventually help us create better equipment indigenously.
Okay.
So they are working very hard on that. I think where we could work better is using, say, AI and technology and connections to create a unified database, on which again government has started working. So like we have our Aadhaar number, now soon we'll have our Asha number, Abha number, sorry, which is the health card number.
Okay.
And all our health data will be stored by the hospital against that number. So it can be seamlessly transferred across the ecosystems.
Yeah.
But we need to create more robust ecosystem. And being a healthcare enthusiast, I think we need to do that very quickly.
Yeah, and do you think like AI can really help to get this?
I think so. Agentic AI should be able to help us there.
Okay.
Because right now, so for example, my hospital, I use 23 different softwares.
Okay.
And none of them talk to each other. So there is so much of duplication. And wherever there are duplications, there are errors.
Yes.
So in healthcare, you cannot afford errors.
Right.
Even a wrong name could mean an entirely wrong treatment being dispensed of.
Yeah.
So then you need auditors.
Yes.
And then you need series of auditors. So all of that can be curtailed if you get agentic AI working better and making those softwares talk to each other.
Okay.
But it could be much easier without even AI if governments were to tell these companies that your softwares needs to talk to each other.
Right.
Which is the health standards globally.
Yeah.
But somehow we have not really looked into it yet.
Yes.
And again, that comes down to organized healthcare, right? Because we don't have as many units who will be on similar platforms. It's impossible for governments to tell that, all right, you need to talk to each other.
Yeah.
Even today we are like countries within a country, we're a subcontinent really.
Yeah.
So I think that is where the gaps are. And it has to be a private as well as public sector effort with patient education and patient counseling. And I really feel here that we need more patient advocacy groups.
Okay. So like what do you mean by patient advocacy groups?
So it's like gender inequality, right? Men making decisions for women is not really going to help.
Yeah.
Unless women have adequate representation, say in education, say in parliament, that gap is never going to be bridged.
Right.
It's more so with healthcare. So what patient needs, really patient knows better.
Yes.
So patients coming up and telling doctors that, you know what, this is what the standardized healthcare looks like.
Okay.
This is the information which an Indian patient needs. And if this were available, because all of us go through health situations, And then we Google.
Yeah.
And then we come across very, very different answers.
Yeah.
I jokingly tell my patient that here is a difficult report.
Yeah.
I give it to you. Will you go out and ask first rickshawala? What is the meaning of that report? You won't.
Yeah.
But essentially that is what they're doing on Google.
Right.
Here the rickshawala knows how to speak English and has no face.
Yeah.
Right.
Yeah.
So patients telling doctors that we need standardized, reliable information.
Yeah.
So that there is no confusion. And then doctors sitting together, creating that information, and more importantly, implementing that information.
Yeah.
Is what is needed.
Right.
So that the variation in healthcare can be significantly reduced, and there is equity there as well.
Right.
And this equity, I think, is very, very important.
Yeah.
You'll never find a celebrity dying of dengue in the Western world.
Yeah.
They've kind of controlled that.
Right.
Because they realize that the public health actually impacts everybody's health.
Yes.
So that sharp focus on public health, eradication of mosquitoes, giving vaccines at the right time, having a unified equity in healthcare would actually elevate healthcare of the private sector as well.
Yeah.
And that is where I think the advocacy groups can play a role.
Do you think people have started having advocacy groups, or we still need to
I think infantile efforts are there.
Okay.
But again, more robust efforts for a subcontinent are necessary.
Okay. So, like, since we've come to like inequality topic, I would like to ask you this question about egg freezing.
Right.
Do you think egg freezing is really like an insurance for a woman? It's empowering her, or is it not? And if you have been in this sector for quite a long time now, is there like a real situation or incident that you could tell us without naming the patient, obviously? Like, how has egg freezing really helped her?
That's again a very good question, very pertinent to what we are seeing today. And like Indra Nooyi said, women's career and her pregnancy career are always at loggerheads.
Yeah.
Mother Nature wanted us to get pregnant at the age of 16 maybe. And that is when we are actually thinking of the new horizons.
Yeah.
And by the time we actually become pregnant, that is when our grandmothers were grandmothers.
Yeah.
Right?
Yeah.
So by 16 they would have their first child, by 32 age their daughter would have their first child.
Yeah, right.
So that is where I think the biggest trouble is. Because from Mother Nature's perspective, our average lifespan was probably 40s.
Yeah.
When India got independence, our expectancy for a man was 47. So by 47, that person would be grandfather of many children and would die.
Yeah. Yeah.
And that is something which has rapidly changed since independence. And we are not able to cope with that.
Yeah. Are we like still stuck in those times?
And we now are getting girls who are 40, 42 and they say that, you know what, I'm married last year, but I'm not really sure if I want kids.
Yeah.
Let me get at least a couple of years and come back.
Yeah.
Unfortunately, ovaries don't listen to that.
Yeah.
And that is where I think egg freezing comes in. And we know even of the celebrities, and I have so many personal patients who did opt for it in time, and that has helped them.
Okay.
Because once you freeze your eggs, they stay at that age.
Yeah.
We know that fertility declines as we age.
Yeah.
Chance of conceiving in 1 year is as low as 40% when you are 25.
Yeah.
It further rapidly declines to around 20% when you are 40. So 20% people in 1 year.
Yeah.
Now once they conceive, there are going to be miscarriages.
Yeah.
Chance of miscarriage at the age of 25 is around 15%.
Okay.
That rapidly increases to around 51% by age of 40.
Okay.
And then there are going to be defects in the babies.
Okay.
At the age of 25, say a problem which is a natural variation, not a defect really, called as Down syndrome, which is intellectual disability in a baby.
Yeah.
Again age dependent, mother's age dependent. So at the age of 25, the risk is 1 in 1500. At the age of 40, it is 1 in 30.
Oh, that like it's a
1 in 30 at pregnancy, 1 in 100 at birth.
Okay.
So sudden steep rise
Yeah.
with the age.
Okay.
Now, if you have frozen your eggs, say at 32, now that increase in Down syndrome,
Okay.
that increase in miscarriages,
Okay.
and that reduction in fertility, you have frozen. And that is how you can slightly turn the nature's clock.
Yeah.
Of course, it comes with caveats.
Yes.
At the end of the day, it's a medical procedure.
Yeah.
It has side effects.
Does it have like major side effects?
If done judiciously,
Okay.
at the right hands, not really. But we need a lot of auditing on that. We need to have a multidisciplinary team to make sure that the lady is fit for the procedure. She really needs the procedure.
Yeah.
And then it has to be done in a dignified, scientific way.
Yeah.
If all of that is done correctly, then it's a very, very safe procedure.
Okay.
And then, whenever she finds the right mate, and if and when they choose to become parents,
Yeah.
that is the time when they can go back to those eggs and they can avail of the pregnancy.
Okay. And do you think with time, since right now egg freezing is quite expensive, like do
Right.
you think with time the prices will reduce and
Yeah.
the
So-
procedure will cost less?
So Umarji Hospital on its own is trying to work very actively on that.
Okay.
And we're trying to reduce the costs rapidly.
Okay.
And we are very sure that in another 3 months, we would have dropped them down by half, really.
Oh, half is like a
Yeah.
really big number.
Yeah.
Okay, okay. And so, do you think if you really freeze your eggs at the right age, you can also save a lot of money on the IVF procedure? Like, or no?
Again, a very good question.
Okay.
So, majority of the money is required for hormones.
Okay.
And the requirement of hormones is defined by the response of the body.
Okay.
And response is dependent on many, many factors, including many unknowns. But what are knowns? The most prominent out of them is age.
Okay.
So, older the ovary, more hormones are needed,
Right.
i.e., much more costs are needed.
Okay.
So, if you do freezing at younger age,
Yeah.
potentially you save on those costs.
Yeah.
Now, of course, when it comes to healthcare, I don't think cost is something which you can actually equate with a parity, in the sense that how do you calculate the interest of all that money which was invested at the age of 32 and then you're going to use it at 40. So,
Yeah.
it's a very complex math.
Huh.
But objectively speaking, yes, somebody requiring ovulation induction at 32 versus at 40
Yeah.
will require inherently more hormones and more money.
Yes, right. It will also give you like that sort of mental peace, right? Like you can focus on other things and your reproduction or like your fertility part is sorted. You've taken care of that. And
Exactly,
Yeah.
exactly. To a larger extent.
Yeah.
Again, nothing is 100%.
Yes.
So one has to keep all of that in mind, and whenever they feel that they are ready for a baby,
Yes.
they should embark on that journey, which is a beautiful journey in itself. But yes, as you rightly said, there is security, and there have been instances where the frozen embryos have been used after 2 decades,
Oh, okay.
and babies were absolutely healthy. So technology has reached to that level now.
Okay.
And also it gives potentially a window to look into genetic diseases in the
Okay.
offsprings. So now there are tests which are available wherein you can actually test the embryo,
Okay.
see if it has common, say, Down syndrome, and then transfer that embryo. So it
Okay.
increases success rates and slightly reduces genetic complications.
Right.
Especially useful for people where there is a known genetic history in the family.
Yes.
So you can actually screen and then transfer the correct embryo there.
Okay. Since like you spoke about genetic history, moving on to the next question, where how important it is for couples who are planning for a baby or planning for a family to get a full health checkup done. And a lot of people, take this very lightly. It's like, जब होगा तब देखा जाएगा. ab to ho gaya. So they are really not concerned about these kind of health checkups that need to be really done.
Right.
So what is your overall view on this?
Right. So when patients come to me and they tell me when is the best time to start exercising so that I have a natural birth, I tell them 2 years before pregnancy.
Exactly, yeah.
Right?
Yeah.
So it's a continuous process. Health is a spectrum.
Yes.
And you cannot say that, you know what, next 3 months I'm going to be very healthy.
Yeah.
So it's especially important if somebody has genetic illnesses or even family history of illnesses, say a diabetes, say an asthma, say thyroid, to screen themselves out.
Yeah.
And embark on pregnancy only when you get a green go by the doctor.
Okay.
Many times what happens is the histories are not very clear.
Yeah.
And most of these diseases, say a diabetic, would realize that they are diabetic many times accidentally or on a routine blood test.
Okay. Yeah.
Or if they had symptoms, by which time it is very, very advanced. So it's very important for a patient or an aspiring couple to first talk to each other.
Yeah.
Because it's not only about medicines and medical health, it's also about emotional health.
Yes.
They want to be parents, they want to have a baby, they don't just want a pregnancy.
Yeah.
And conception to birthing and then parenting is a really long journey.
Yeah.
So it's absolutely crucial for people to come forth, talk to the doctors, and then they'll be really surprised to know that doctor is interested in their history of where do they work.
Oh, okay.
Because say she is a healthcare worker or she is a primary school teacher,
Okay.
she's more likely to acquire viral infection from the kids around her or patients around her. So she may require a different battery of tests.
Okay.
Compared to say a software engineer who is working from home.
Okay.
If she has a pet, she needs different kind of environment and testing
Okay.
than somebody who does not have pets.
Yeah.
So all these minute details
Okay.
are also important in her medical history and her partner's history. And then there are, of course, obviouses that are you smoking or do you do drugs or is there any alcohol involved? And I've had patients doing all of that.
Yeah. In fact, I would like to I'm sorry I'm stopping you here in between. If people say, oh, we were smoking or we were having alcohol at the time we conceived, or it actually happened on that night when we partied, and it's all okay. You don't have to go through major lifestyle changes to actually conceive naturally. So, what is your view on that?
So Mother Nature is very kind.
Okay.
And it does protect the offsprings as much as possible, whatever the parents do.
Yeah.
Having said that, it's not a blanket cheat. And many times I've seen that the habits of the parents, they do impact the offsprings.
Okay.
And when I say habits, it's not only about addictions. It's also about lifestyles. So say, for example, sugars. A simple diabetes which impacts the third trimester of the pregnancy, called as gestational diabetes, can cause premature births, can cause big babies, traumatic deliveries, cesareans, post-delivery complications in the baby, and early diabetes in the offspring.
Okay.
If the same person were to control her sugars well, and in 90% of the cases, she can do it by diet alone, with exercise.
Yeah.
She does not need medicines.
Yeah.
Then that person would reduce all those risks significantly and they'll come back to those of general population. Now this is more so over true for addictions.
Okay.
So, I practice in this part of Pune and around 20% of my patients have some habits. Just to put it in a context, I had a patient who didn't know she was pregnant.
Okay.
She came to me at 22 weeks. She had missed her periods for a few months, PCOS.
Okay.
And she did a pregnancy test, was positive, went for a scan, realized that she was 22 weeks pregnant.
That's a long time, 22 weeks to realize. Oh.
And similarly, she was shocked.
Yeah.
So was the husband. And by that time, she was smoking 2 packets a day, had drank alcohol so much that thrice she had to wheelchair back home.
Oh God. Okay.
She was doing marijuana once every night, and she had done cocaine thrice in that period.
22 weeks period.
Baby is 3 years old. Baby is absolutely fine. Right?
Thank God. Okay.
But that's a scare, not
Yeah.
only for the parents, but also for the doctors, because you don't know what all to look for.
Yeah.
And for many aspects, even with the best of the medicines, best of the technology, you don't have tests. It's only the time
Okay.
which will tell you if things are okay.
Yeah, maybe it could develop later in the baby.
Yeah. Absolutely. Absolutely.
So there's nothing which we can check when the baby is out.
There are few things which we can check.
Okay.
And there are many more which we cannot.
Yeah.
So termination is not an answer because you don't know when you will conceive, especially with the history of PCOS.
Yeah.
Where she has been getting, say, 2 periods a year. That is how she missed it, right?
Yes, yes.
At the same time, you need to be really, really cautious. You need to do so many things, and still you are going to be unsure, say, up to 6 months or 1 year or 5 years, based on what you're looking for in the baby. So, yes, there are so many babies who are protected due to nature's way.
Yeah.
But that does not mean that you smoking through the pregnancy really is going to help.
Yeah.
I know so many other side effects of smoking. And again, you are going to need parents
Yes.
for a while, and smoking reduces that chance very rapidly.
Yes.
So it's better not to.
So if a couple were to conceive naturally, what would be step 1 before they even start trying?
Right. And as I said, it's an emotional journey as well. So being on the same path. Gone are the days when they used to say, "Arey, jagda hai kya? Bachcha kar lo, jagda khatam ho jayega."
Yeah.
Right?
Yes.
So that's not really the answer.
Yeah.
So you need to sit down, you need to take help of counselors, you need to work out, you need to focus on your own health.
Yeah.
Unless you love yourself, you cannot love anybody else.
Yeah.
So start working on that. Understand why you really want a baby.
Yeah.
Is it just because your peers are having babies? Or is it something that you want to do? And is your partner on board with the same?
Yeah.
And even if they are not, that's okay if you feel that you're confident to look after themselves. So if...
But won't that lead to like postpartum? Like if you right in that moment you would feel that, oh, I can take care of the baby alone. But if the husband is not on board,
right.
What happens later?
And for many girls that may happen.
Yeah.
But for many others, they're really strong. So they can look after themselves. They can look after their babies.
Yeah.
So to each their own. So as a doctor, I would love to learn and listen from my mother what she wants to do.
Yeah.
And if she feels that she's okay, I have so many ladies who are single and have babies.
Yeah.
And that's okay too. Right?
Yeah.
So I don't think we are in any position to judge them. We are in any position to say that just because you don't have your partner with you means that baby is going to be compromised.
Yeah.
At the same time, she needs to figure that herself.
Yeah.
So if she feels that I'm okay with this, she can go ahead with the motherhood.
Okay.
If she feels that she is not, she may not want to embark on that journey right now.
Yeah.
And everybody is different.
Yeah.
Right. So that is, I think, step number 1, where they prepare themselves emotionally as an individual or as a couple, depending on their circumstances.
Okay.
Now that the emotional preparation is out of their way, it's always better to get their health checked by a doctor.
Yeah.
Because you certainly have so many friends, Payal, where they went on their own to gymming, and an enthusiastic gym instructor ended up in hospital.
Yeah.
So they need to understand what are their limitations.
Yeah.
And now there are standardized tests for it.
Okay.
So if you come to Umarji, you must have met Dr. Prachi. She has all those gadgets and tools. And every good women's health physiotherapist now have those gadgets.
Okay.
They assess you. They assess your baseline stamina. They assess your muscular health. And depending on that, they actually write a prescription of exercises for you, which you can get executed from your gym instructor.
Right.
Tell them no more than this.
Okay.
Go after a month. Again, check whether you have progressed. Get the fine print. Go back to the instructor. That will make your gymming much more playful and much more safe.
Yeah, because you need to test your body's limits.
Exactly.
Okay.
Then there are nutritional supplements which you can take. There are many tests which are available in the market. And what has happened is healthcare here has become a market and not a service.
Yeah.
Because of commercial labs and so many aspects of commerciality to it.
Right.
So what we need to again do is find a good doctor.
Yeah.
Go to them, sit down with them, talk about yourself and the partner, talk everything candidly. Be rest assured that they want to hear all of that. They're not going to be judgmental.
Yeah.
Because unless they hear that, they're not able to advise you appropriately.
Yeah.
And then they can actually jot down the pre-pregnancy test for you. As I mentioned, your profession will define the umbrella of testing.
Yeah.
Your age will define it. Your ethnicity will define it. Your origin in India will define it. So there are many aspects to it.
Okay.
And a doctor will carefully go through all of that. And then that will be given to you as your own prescription.
Okay.
It cannot be a healthcare package.
Yeah, yeah.
It has to be individualized always. Now, once those tests are done and once we have the baseline results,
Okay.
then we know from where do we need to travel anywhere else. For most of the mothers and fathers, there is no need.
Okay.
They are already healthy. As I said, nature is very kind.
Yeah.
And it's going to take care of most of these issues on its own. So once you have reached that level, of course you go for habit changing, you go for lifestyle changes, you do go for workouts.
Yeah.
At the same time, you can start trying.
Okay.
In most of the cases.
Okay.
If I were to mention a few important tests which should be pre-pregnancy,
Okay.
I would certainly say a detailed history taking by doctor,
Okay.
a general checkup by a doctor, including blood pressure, which is very important. Depending on the history, they may need sugar tests or they may need some additional urine tests. But all of the would-be mothers should definitely go for rubella immunity testing. Rubella is one of the commonest diseases which impacts the health of the babies in the womb in India.
Okay.
And our governments have recognized it long ago. For many decades, we have a very successful rubella program where every child is vaccinated at the age of 9 months.
Okay.
And 92% population of Indians is already immune to it.
In case she misses that, are there could there be any complications?
So if she is not immune and if she were to get rubella in pregnancy, that impacts babies.
Okay.
Rubella is a very mild infection for most of the adults.
Okay.
It just causes fever, running nose, rash, and all of that disappears.
Okay.
But the virus goes to the baby, and if it impacts the baby early on, especially in first trimester, it can cause blindness, it can cause heart defects, it can cause small brains, and many other such problems.
Okay.
So it's always a good idea to test yourself for that.
Yeah.
A simple vaccine, if you're amongst those 8%ers, you can take that vaccine and then take a break of around a month and then embark on the journey. The vaccine is not safe in pregnancy. So once you're pregnant,
you can't
apart from masks and avoiding people, you can't do much.
Okay. Okay.
So that's one important test which every mother should get.
Okay.
The other important test, I believe, is hemoglobin electrophoresis, aimed at finding out a condition called as hemoglobinopathies.
Okay.
Thalassemia and sickle cell anemia are the commonest in India. Around 5% of our patients are carrier of those.
Okay.
And if a carrier marries another carrier, there is 25% chance that they'll have a baby with disease.
Okay.
These are the babies who require blood transfusion, the only cure they can look forward to is bone marrow transplant if a donor is available and if it is successful. So life expectancy is severely limited, and they end up being hospitalized every month or so, or even more frequently. They need blood transfusion every month or even more frequently. With blood transfusion comes its set of allergies, allergic reactions, infections. They tend to accumulate a lot of iron in their body because they're getting foreign blood which is not getting extracted out of the body. So they need expensive medicines to remove that. And then there is toxicity to the heart, toxicity to the liver, etc. And all of that can be very easily be predicted and prevented with a simple test called as HB electrophoresis. So before pregnancy, ideally, or early pregnancy at least, one should embark on that. And then if somebody screens positive, their partner also needs the same testing.
So do they have to take like some sort of a vaccine to get
no.
that in order?
So if both of them are positive, they have two pathways. One is they may choose to go to IVF and test the embryo outside. Make sure that it does not have thalassemia major and then transfer it in. Soundingly very reassuring method. Very expensive. Because natural pregnancy is now getting converted into IVF. With IVF, best of the units, take-home baby rate is usually 60%. I'm not talking about pregnancies. As I said, there is a huge gap between being pregnant and being a mother. Many pregnancies miscarry. So, take-home baby rate with best of the units is around 40 to 60%. As against that, Mother Nature's take-home baby rate for thalassemia is 75%. Because 25% babies will be affected. So, if the parents are emotionally ready, what we tell them is conceive naturally. Let us test the baby at 12 weeks. At 12 weeks, there is 75% chance that your baby does not have thalassemia. It is absolutely cost effective to test it in the womb. If you are amongst the other 25%ers, and if you are okay with the idea that I'm happy to support the child, you can embark on the pregnancy, deliver, and accept what was there. And sometimes some parents may not be up to it. And they may feel that it's not in my capacity to support such child. And I've seen them stopping those pregnancies. And that is something which is okay too, if they feel to do that, and we can support them in that. So usually when it comes to thalassemia, I tell them to screen themselves. If they turn out to be positive, both of them, there is 25% chance. Let us test them at 12 weeks. If there are thalassemia children more than twice, then maybe they can think of IVF. That is more cost effective way, provided they are of the opinion that they can accept termination. That is the second test. And this test also looks for sickle cell anemia, another disease which is very similar to thalassemia. And similar statistics, it has 25% chance of babies being affected. This test also helps us identify HbA1c, her last 2-3 months sugar levels, free of cost. Because it's the same technology. So you just get a machine which gives you both. And cost is the same. So that helps you look into the window of whether she had diabetes which was pre-existing without symptoms. And that is also very important because uncontrolled diabetes impacts the baby's health entirely. If it is severely uncontrolled, diabetes is actually teratogenic, meaning it can cause injury to developing baby. It can cause defect in the spine, maldevelopment of the skull, defects in the heart, miscarriages, many other problems. And this number increases percentage wise as the sugar levels rise. And HbA1c is a surrogate marker of that.
Okay.
If you look at pregnancies, the natural incidence of birth defects is around 2 to 3%.
Okay.
At the HbA1c levels of less than 6.5, it remains at 2 to 3%. And as the levels increase, it increases to say at the level of HbA1c 10, it is around 15% to 25%.
Okay.
So as the levels increase, HbA1c rises.
Yeah.
I mean, the defects also rise.
Rises, yeah.
However, a lower HbA1c would significantly reduce that risk.
Okay.
And again, having said that, drawing from the previous analogy, we have had patients with HbA1c of 10, 12, 13 who have healthy babies. So again, HbA1c alone is not an indication for termination.
Okay.
Still 80 to 90% babies are going to be okay. And if the parents are okay with that idea, they can safely continue pregnancies.
Okay.
Right?
But you still have that 10%
Yeah.
factor where things could go wrong.
Exactly.
Okay.
So what I'm going to do is I'm going to post a testimonial of a mother. That child I think is now 10 years old or more. Her HbA1c I think was 11 or 12 when she had conceived. And she chose to continue with the pregnancy. And he's doing well.
Fine. Okay.
Right?
Like you
So-
said, the offspring's Mother Nature is going to protect them.
Precisely, precisely. So in most of the cases, we have healthy outcomes.
Okay.
So do not go into panic mode and terminate the baby just because it was like this. There are safeguards which can be worked upon.
Okay. So are these like the tests? These are the essential tests that need to be done.
Amongst the others,
Okay.
so we have spoken about rubella. We said we want to do HB electrophoresis. We would also like to know about her baseline health. So we have done a checkup, but we also want to do hemoglobin, which again HB electrophoresis gives free of cost.
Yeah.
So 4 things in one go. And then if she has anything from her profession, her family, her geography, we would like to investigate more on those.
Okay.
Once we have got all this data on her, we say partners are pretty useless otherwise. We don't need them.
Yeah.
Just joking. But usually the
Yeah.
sperms again get protected
Okay.
because there are so many of them.
Yeah, right.
I jokingly tell it's easier to be Prime Minister of our country compared to for a sperm to become a father.
Oh,
Because
yeah, actually,
millions and millions of them every ejaculate.
Yeah.
Lifetimes of ejaculate, 1 or 2 get to be fathers.
Yeah.
Right?
Yes, yes.
So, from that perspective, usually again Mother Nature has survival of the fittest. So
Yeah.
usually the fittest of the sperms, they go ahead and they conceive the embryo. I mean, they conceive the egg.
Yeah.
So again, many of those risks are sorted out by the Mother Nature.
Yeah.
But again, fathers getting tested themselves, making sure that, so many times we also come across families where the marriage is arranged
Yeah.
and they've never been intimate before they married.
Right.
And then there are so many surprises.
Yes.
So all those aspects, we need to very emotionally ponder them, understand what's going on,
Yeah.
and remember that IVF is not the solution for everything.
Yes. I think it's so important that you being a doctor, gynecologist, you are saying that IVF is not the solution for everything because there's this fear-mongering thing going around in India everywhere that these days doctors, they just want to get the IVF thing done or they just want to look out for C-sections because that's how, they would make money and but I don't see from the time I have conceived or I've been pregnant. I think I have been on this search for a good doctor, and we've so my husband couple and I, we both have been on this search, for getting like a right person, a right doctor who will understand our needs and who will understand our lifestyle, and that's how we ended up, coming to you and you understanding each and every patient's need. So I would like to know your point of view on this scare thing that's going on. Ki doctors these days just, opt for IVF or C-section because that's how they make money.
I think let us go one by one. So if we are talking about IVF, usually what happens when a patient reaches to an IVF specialist care, they feel that they need to help the patient the best way they can. and the best way they know is IVF. Because look at the numbers.
Yeah.
We just saw that chance of natural pregnancy in one given month is around 3 to 4%.
Right.
With slightly better technologies, say for example giving medication for ovulation or giving IUI, where you take the sperm, filter out the healthy sperm, put it directly in the womb with ovulation induction, your baseline chance improves to around 8 to 10% with the first step and around 12 to 15% with the next step.
Yeah.
Over 3 to 4 cycles, that would bring to cumulative percentage of 40 to 60%. As against that, IVF in one cycle gives 40 to 60%.
Okay.
Now the issue is, because we don't have an organized healthcare, a primary patient who probably need not see the IVF specialist bypasses the entire healthcare. In the older days or in the Western world, they would go to their GP, then they would go to the obstetrician, and then they would be referred on to the IVF specialist.
Right.
All of that is bypassed.
Right.
So with the best of the intentions, the IVF doctor would know that this is the best technology which can help them achieve that goal sooner.
Yeah.
Now whether that is needed is patient's prerogative.
Okay.
And that is why going the right way probably would make life easier for most of the patients.
So that thing needs to be organized, that system.
So we need to re-establish the old referral pathways, wherein there were filters at every level. Of course, it has its own waiting times and its own caveats, but there are ways which can handle those better. Now coming to the cesareans, because it is, I think, the other obvious which many people come across.
Yes, yeah.
And
I mean, I wouldn't blame it just on the doctors. There are a lot of girls who I know, they opt for C-section. They're like, I don't want to go through the vaginal delivery. It's like really painful. I don't want to go through the stitches, or like I just want to go and opt for C-section. So it's not, I don't think it's like a complete thing on the doctors, but the overall thing of C-section rise in India. What would you like to tell about that?
So, I always give analogy of friendships here. So, if you are a person with friends who are divorcees, statistically you are more likely to be divorced. So, there are a lot of studies on that. And I would love to study the emotional makeup of girls who have more girlfriends who had natural births versus more girlfriends who had cesarean.
Oh, okay.
And I believe, again, statistics would be very similar. If you have more friends with cesareans, you are more likely to have a cesarean.
Okay.
So, I always tell people that if you want a natural birth, make friendships. Learn from other people how they delivered naturally, how they prepared themselves.
Okay.
And then you'll be surprised that, oh, this girl had a stitch and she's dancing Garba in her 9th month. This girl had a risk of premature birth and she's lifting weights every day in gym. And then you'll realize that physiology is very, very different than your interpretations.
Yeah.
Most of this advice has come from the grandmother's tales, wherein the demographics was entirely different. She was getting pregnant at the age of 15. She had very less empowerment. And she had huge laborious tasks.
Right.
In a country which was perished by famines and maybe British and thousands of years of operation. So we didn't have food to feed ourselves. And that is the reason why our ancestors very cleverly said, you know what, give her a laddu of dink. That will help her. Because, notice this, do you know how much calories do you need when you're breastfeeding a baby?
No.
Worth 15 kilometers of walk.
15
kilometers of walk a day. Yeah.
Okay.
And how many calories a dinka laddu has? Exactly the same amount. So that was bridged very cleverly by the ancestors for a girl who herself was a teenager. And she had a baby in the womb. And she had huge physical labor. In our age, she were to be a grandmother.
Yes.
And for her, they had written Vanaprasthashram.
Okay.
That is what we need to do for our mothers today.
Hmm.
But we forget all of that. We
Yes.
forget that we are dealing with a different demographics who is sitting in front of the computer at the age of 35 or 40 and not washing her clothes at the river, fetching water from the kuwa,
Yes.
and grinding flour on the chakki.
Yeah.
And that is the reason why we are seeing this rapid rise in all the problems in pregnancies, even conceiving, and cesareans. That is, of course, one part of it.
Yeah. Okay, so coming to the second point,
Right.
you said, like, since initially it was necessary, you having those many calories, because women who was breastfeeding was also doing that much amount of work. But in the current times, it's really not that necessary.
Precisely. I think that is the simplest way of putting it up.
Okay. Okay.
So we need to restrict calories. We need to burn more calories.
Yes.
And we need to understand physiology of calories in general. Because we get calories from carbs, protein, and fats. And in our traditional diet, we end up consuming most of them through carbs.
Yes.
Which is necessary in a farm-based economy.
Which was the case 50 years ago.
Precisely. So if you know farmers and laborers
Yes.
around you, give them carbs. They probably need them, and quite likely even today they are conceiving at the same ages which you have been doing for thousands of years.
Right.
But if you are not that person,
Yeah.
maybe you need to change. Right? And there is very strong association between pregnancy complications, right from conceiving to miscarriages to defects to cesareans to even postpartum recovery for the mother as well as the baby, to baby's long-term outcomes, including what we call as metabolic syndrome, complex of diabetes, obesity, and hypertension,
Okay.
and related diseases. May that be backaches and arthritis and so many others which we see every day in our mother's generation.
Yes.
Because that was the generation where it very rapidly changed.
Yes.
Those were the people who kind of went away from the farms.
Yeah.
They started having pregnancies later, but they never had the enlightenment of moving away from carbs.
Right.
All of them will tell you that they put on a lot of weight during pregnancy. The weight gain very rapidly increased after they stopped breastfeeding.
Yeah.
And till now it has not gone away.
They still struggle with it. Yeah.
And now they need knee replacements.
Yeah. Most of the women who are in their 50s and 60s, they need knee replacement. Like, I know so many of my orthopedic friends, they are like, all of them, because there is no other solution apart from replacing the knee.
Precisely.
Then again, it's that scare thing. Oh, if I go to orthopedic, he is going to, replace my knee, so mujhe jana nahi hai doctor ke paas.
So true. So prevention is the best cure. And prevention does not start in their 40s really. It starts in their pre-pregnancy.
Okay.
Pregnancy makes them vulnerable. They prefer taking protein powders, protein supplements over taking protein through diet.
Yes. Yeah.
Now you work out regularly
Yeah.
and you do need proteins outside your pregnancy.
Yeah.
But when it comes to pregnancy and protein supplements,
Yes.
remember all these are coming out of machines, which are heavy metals.
Yeah.
So they are going to contain heavy metals, and also if you're not going with a good scientific brand, probably you are consuming carbohydrate powders and not protein powders.
Okay.
So
even if the label says that it has that protein, it could have more carbs in it.
Exactly. And any average protein brand in India, if you look at it, it has 50% upwards of carbs and 25% of protein.
Right.
So
again, the protein thing is not regulated that much in India.
So they feel it is chocolate flavored. I like the taste and I'm helping the baby.
Yeah.
And then they start putting on weights.
Yes. Have you actually noticed that difference? And that is why I don't think any of your patients consume protein powders, because I'd asked you and you said no, just stay away from it and try to consume it through natural sources.
Precisely. When you're not pregnant, I don't mind that. because that's not going to go to your baby.
Right.
And I do understand that it's very hard to get protein from natural sources.
Right.
But when you're pregnant, I think you need to work on it, right? Because here is another living being inside of you who needs to be filtered away from those chemicals.
Yeah.
And that's the reason why we don't give protein supplements during pregnancy, but we do want you to take protein through your diet.
Okay.
Because there are so many nutrients other than proteins in the diet if you take it balanced.
Yeah.
So you must have noticed that I don't even give iron supplements to most of my patients.
Yes, yeah, you don't.
So what happens with medicines is that there are so many humans involved in the process of manufacturing to transport to prescription to dispensation and then consumption. I remember this case very distinctly, wherein this pregnant girl was consuming iron tablets regularly, or what she thought were iron tablets. She realized 2 weeks later that those were her mother's anti-cancer tablets called as methotrexate in a pregnancy.
Oh God, okay.
But the team looking after her was very sensible. They took multiple opinions. They did not terminate the pregnancy. Baby is 1 year old, baby is healthy because Mother Nature is kind. Right?
Yeah.
So, again, but many times you may end up in a situation where you have to terminate a perfectly healthy pregnancy because of errors at all these levels.
Yeah.
So for us, we feel that it is just one dispensation, one prescription.
Yeah.
But apart from its own side effects, there are so many other factors involved.
Right.
So I believe food is the best medicine. And if you take balanced diet throughout your pregnancy, there are many supplements which you don't need. Maybe we need vitamin D.
Okay.
Because culturally, again, we have moved away from farms.
Yes.
We don't get sunlight.
Yeah.
We have not gone into a Western world of bikini sunbathing.
Yes.
So we are in the middle somewhere where we are absolutely oblivious to sunlight.
Yeah.
Similarly, we of course need folic acid because again it is not there in the natural food stuff enough. But beyond that, if you are that way well to do, you probably can get everything through a balanced diet. Our own government does recommend 100 tablets of iron throughout the pregnancy.
Okay.
But that is probably not required for most of our well-to-do women, provided they are able to take it through diet. Again, mind you, most of our guidelines are going to be focused on socially deprived, underprivileged, where she can just get a vada pav in the market. She cannot afford to have fruits.
Yes.
She cannot afford to have non-veg.
Yes.
And for her, that supplement matters a lot. And maybe that so-called protein supplement, which was really a carbohydrate supplement, would also help her there.
Yeah.
But not for you and I. And that is something which we need to understand. We need to understand our body well.
Yes.
And you must have noticed that I don't want you to put on a lot. And I'm in a habit of giving weight gain targets. That in this pregnancy, your starting BMI is this much, your end BMI should be this much. You should not go beyond that. That's a standard practice world over. Every doctor wants you to do that because that is going to prevent the rapid weight gains and all those impacts which were going to affect her in the future.
And also C-section. It's going
Precisely.
To,
Precisely. And also the progeny. वो कहते हैं ना कि बच्चा पढ़ता है, माँ पढ़ती है तो पूरा खानदान पढ़ता है. Same thing is truer for health. If mother is healthy, the entire family is healthy.
Yeah.
And this is a golden opportunity where we can, turn the stones and make sure that the things are corrected rightly. I jokingly tell patients that if you do this right, in next 2 generations, you'll eradicate diabetes in your family.
Yeah, yeah.
Because in yoga, there is a concept that your heartbeats are numbered, your breaths are numbered. Similarly, your insulin is numbered. If you're exposed to more and more sugar while you're even not born yet, you're going to exhaust all that insulin inside the womb.
Yeah.
And when you reach your 30s, 40s and 50s, you'll not have enough.
Okay.
And that is how the early onset of metabolic syndrome is on the rise. because we miss out on so many diabetics. Many times I come across a diabetic who has recently found out in pregnancy that she is diabetic. I tell her, go home and test your mother. And they come back and half of the times they are already diabetic.
They have also not tested.
Yeah. Because it's such a silent disease. You don't realize it unless it causes something catastrophic.
Yes.
Or unless it is accidental. That you went for something else and you came home with a report of diabetes.
Yeah.
Right? And then it is very difficult to understand and accept as well.
Yes.
Because there are no outward symptoms. It's a silent killer.
Yes, it is. Yeah. So, like you said, very rightly, like you don't give protein powders, you don't give iron tablets. Again, you come from the school of thought that a lot of people, doctors, get the GTT, the glucose tolerance test, towards the third trimester. And then it's too late, I feel, for that. And you're someone who comes from the thought that in the start of second trimester, you ask patients to keep a sugar diary. And you can make lifestyle changes at that moment, which can actually control gestational diabetes in the third trimester, which can help you have a healthy delivery. So why is this school of difference existing in India currently, and why is not everyone following the same thing? Where does this come from?
So any practice in medicine, I believe, should be evidence-based.
Okay.
And when it comes to sugars in pregnancy, there have been robust trials globally who have documented how sugars, high sugars in pregnancy behave towards mother's health and baby's health. And then they took checkpoints and they said that beyond this limit, we should call them a gestationally diabetic because the outcomes get compromised.
Okay.
Now, these values came from many Western trials, and they said that doing a test called as modified glucose tolerance with glucose load to the mother would help us screen many mothers.
Okay.
They initially screened mothers based on their ethnicity. And because whites are less likely to develop diabetes early on, they said that for whites, maybe you may choose to do it in the 7th month.
Okay.
If you are anything but white, you should get it in 16 to 18 weeks. That's a very old evidence.
Okay.
And it has been proven true for many, many years. Now, the caveat here is again standard equitized healthcare, wherein you give a special form of glucose called as anhydrous glucose, not just a commercially available glucose.
Okay.
You dissolve it in a set amount of water, which is around 200 ml. You drink it within 5 to 10 minutes, and then it is measured on a standardized equipment within standardized time. Again, because we are a subcontinent and we do not have central regulation on home collections, etc., the transit time to the lab greatly varies.
Okay.
The methods of testing greatly vary, and thus the results greatly vary. Because the moment blood comes out of the body, the glucose starts depleting.
Okay.
So by the time it reaches lab, many times it is lower.
Okay.
So there are what we call as false negatives, meaning that she does have sugars, but we have missed out on it.
Okay.
And this needs robust auditing, which may or may not exist in many setups.
Yes. Yeah.
And that is the reason why.
So ideally, she should be present at the center for like when she's
Precisely.
getting it.
Precisely.
Okay.
And it should be sampled and tested quickly.
Okay.
Then we may have better results. And in many patients, we have seen that they are not able to tolerate that much of sugar. They puke, they faint, etc., etc. And anyways, it is not very natural. So an alternative to this could be the step which is actually beyond this, in the sense that, say, in a theoretical world where she screens positive on this test called as MGTT, what will happen? We tell her to go home and see how the behavior is at home. Because how many times in your real life you drink 75 gram glucose in 10 minutes? Never.
Yeah.
So try to see what is happening with physiology
Right.
with her routine exercise, routine glucose levels, and routine food. Because just to cite an example, you ate food and you walked for 20 minutes after eating, your sugars drop by 30%.
Yeah.
And making use of that knowledge, what happens is we want them to monitor their sugars at home, again on a standardized platform.
Yeah.
Because these approvals are going to make sure that the machine they are using is appropriate and the values we are looking at are reliable enough.
Yeah.
And once that happens, then it's much easier to predict outcomes and control the outcomes as well.
Yes.
Which is most of the times lifestyle again.
Yeah. So, in terms of lifestyle, like we discussed, and you said that she needs to start preparing, like, if you're planning for a pregnancy, at least 2 years is what you need to give to your overall reproductive system. And so, how important is it for her to actually, for a female to lift weights?
It's very important. As you know, females inherently have slightly weaker bones, and strength training helps with bones.
Okay.
So, for her own health, it is important. Even from birthing perspective, it is important. Just now, I witnessed a birth where I had to make her squat, holding her hands, and she was like with her butt in the air. She was like that for 20 minutes. Every time there was a contraction, she would go up and really push hard.
Yeah.
Now you need immense strength and stamina for this.
Yes.
And if you could achieve that, you have a stitchless delivery.
Oh, okay.
Right?
Yeah.
Which Mother Nature had intended. You look at all the birthing goddesses of all the ancient cultures, they're never lying down in the bed and delivering. They always sit and birth. Because gravity helps, your muscles help. If you have heard Dr. Prachi talking, she always tells you that when you're pooping, the knees should be higher than your waist. So now the West has come out with stepping stools.
Yeah.
But Malasan we were doing for thousands of years.
Yes. Yeah.
Because this is much more physiological. And that is something which we need to work upon.
Okay.
That is something on which we need to focus. And we need to really learn how to live. Because medicines can help you, but they cannot change your life.
Yeah.
And a change in your life can actually change your life.
Yeah, right.
So, I believe these are the aspects which, if we get adequate education, a window of learning into ourselves, we can make a difference to the society.
Okay, so pregnancy in diabetes, like gestational diabetes, is it on rise only now, or is it just we are talking about it like right now? Do we have like better access to medical devices that we can self-check at home, or?
I think both.
Okay.
So our understanding has improved over the last 4 decades, 5 decades. And our age at conception is also increasing, which is directly proportional to all the outcomes, including diabetes in pregnancy.
Yeah.
So a mother who conceives at 25 years of age is less likely to have sugar intolerance compared to a mother who conceives at 40. So yes, diabetes is on the rise with the demographics and our age of conception. It's also on the rise because our previous generation, we did not know about the diabetes and we had carb-rich diets.
Yeah.
It's also rising because we have sedentary lifestyles and our window in health may not be up to the mark and our know-how of the health is not up to the mark.
Yeah.
So all these factors combined impact diabetes. But if we analyze them one by one and control them one by one, we can have excellent outcomes.
Okay. And in terms of medical devices, like how do you know which brand can you trust? What are the parameters that one needs to check that this machine is going to be good for me and is going to give me accurate results?
Right. So it's really about economics, and getting yourself audited is always expensive. So companies who are competing in the open market, they would like to reduce their costs.
Right.
And if there is an unregulated market where healthcare devices can be sold without adequate scrutiny, then they're going to go for that, because then they save a lot on the certification. So what we need to look at is global standards and certifications which they should have. Now you put this rider on. Again, companies want to deviate away. So I know of companies who sell glucometer as a package. So they have glucometer, strip and the needle. And they take certification for the needle. That is the cheapest. And they sell this without this, but on the package it says that we are certified by so and so body.
But then they won't be that transparent enough to say that which one we have tested.
That's correct. And then maybe again through patient advocacy groups, through doctors groups, we need to create awareness with the government bodies that these are the aspects which are needed to be regulated.
Right.
And people are slowly going in that direction, but hopefully if the pace is faster, it will benefit more people more rapidly. And now that the technology is that accessible, it's not that difficult. So I know of a very prominent blood pressure machine manufacturer who is present in multiple countries. They sell a device in our country without regulation. And the same device is sold in the UK at lesser price after auditing and certification, because they want it that way, and the competition and market forces would make them reduce the price, and the market forces would make them get a certification. So although their cost per device is higher, the selling price per device is much lower than the same device being sold in India. So we as a society, as government bodies, are slowly getting aware about it. And we are trying to work towards that, because from companies' perspective, it's very natural for them to protect their interest. From society's perspective and doctors' perspective, it's very natural that we want our patients' interest to be protected. And I think that tussle will always keep going on. We need to be more aware, and we need to be on the ball to control that.
Yeah, definitely. And I think we have like a lot of questions more, but given the time, we won't be able to continue. But I hope that we meet again soon and we can have a longer discussion. But is there anything that you would like to end this podcast on, and something that we've not touched on, but it's something that is really closer to your heart, and you would want people to know that they're completely ignorant about in terms of pregnancy, reproductive, overall women's health?
Right. So in last 10 years since I've been here in our country, I've realized that termination has become a very go-to tool by many people. They don't use contraception, they go for termination. They feel there could be even slightest of the doubt, they go for termination. Wherein they largely underestimate the probability of conceiving. They feel that, you know what, I've conceived right now, I'm going to conceive again later. And somehow that stress of termination, that wrong assumption of conceiving again has kind of put a lot of pressure on many women. There is guilt, there is stress, and then there is this desire to perform that next time I'm trying and within 2 months I'll conceive. And that's not going to happen, even with the best of the chances. It takes around a year for 60% couples to conceive, 2 years for 80% to conceive, and 20% will not conceive even at the end of those. So when the odds are so skewed, every baby is precious. And plan them carefully. If you are in a doubt whether you want them or not, maybe think of an insurance like egg freezing or embryo freezing until you are emotionally and physically ready. Remember that they don't need money, they need you. So organize your time wisely. Believe in Mother Nature's forces, believe in yourself, and try to be as natural as possible when it comes to pregnancy, conceiving, delivering, and dieting. We could not touch upon benefits of natural birth or cesarean today.
Yeah.
We would love to do that.
Yeah.
But there are so many inherent benefits of natural processes which humans are slowly understanding.
Okay.
For example, healthy bacteria which get transferred to the baby in the process of birthing. When I was a student, I did not know about it.
Okay.
Slowly when I started learning and understanding more, and then the trials came, and then we realized that, oh, Mother Nature had devised it thousands of years ago.
Yeah.
Now we are realizing that it is more beneficial.
Okay.
There could be so many hidden benefits which modern medicine doesn't know as of today. So never underestimate those powers.
Okay.
Do not feel that I can conquer nature by this.
Yeah.
And remember that when you're thinking about pregnancy, it's not only about that baby in the womb. It's also about your journey as a parent and many, many more generations to come.
Yeah.
And every small step you do today is going to help your progeny 10th generation, 15th generation later.
Yeah.
So just be wise and happy parenting.
Thank you so much. I think we've had a lovely, wonderful chat and understanding the overall maternal health. We would like to dig in more deep. Maybe we'll have that conversation again later when we have the time. Thank you so much for coming on Sukoon's podcast, and I mean, advise people, whoever is in Pune, to all the girls, that if you are looking for the right doctor, you know where to go to.
Oh, so kind of you. As I said again, every doctor wants betterment for their patients.
Yes.
So just believe in your doctor wherever you are.
Yeah.
Lot of love and positivity to you. Keep educating yourself.
Yeah.
And thank you, Payal, Kapil, Team Sukoon for this opportunity. It was really a pleasure to be here.
Yes, thank you.
Thank
you so much.
Bye.